that's important, you know. But
experience can rewrite those pathways too.
Well, yeah, I feel like if the drug isn't hitting me hard, then the pathways aren't getting rewritten as well. Yeah. So, and I don't know if that's true or not, but
well, there's always theories on whether or not dissociation is really important for something like ketamine or Spravato to work. And thankfully with Spravato, it's less important because, you know, it's covered by insurance, and sometimes it's this deeply contemplative place that people are at, and other times it's like, oh, okay, that felt a little nice or whatever. So
yeah. I mean, I never had the same. It's was it there's some drug that people talk about, like that they drug and they. It was Dune, actually.
The spice from
Dune?
Dune?
Real. Yeah, the spice from Dune. They say it never gives you the same effect twice or whatever. You know, when you take it, it never tastes the same because the theory was that it rewrites in order to keep you from getting used to it. You know?
Right.
And it's always novel that way. But the Spravato treatments are never the same, you know, on any 5-week sessions or whatever, you know. Some days are one way and some days are another.
Well, now you're down to about one a month, aren't you?
Every 3 weeks is what I'm at. Yeah. So.
But that's why it works for you, because in your case, they had to go up and up on every single, you know, pain drug, anxiety drug, depression drug. Since I mean, your middle name is Wolverine. I mean, let's be honest.
Right.
It literally is.
Had it changed.
Yeah. So he's no longer Wolverine.
For other reasons, but they said you can do whatever you want with your middle name, and I'm like, really? And they're like, yeah. I'm like, okay, I got some ideas. But yeah, so someday the Spravato, like the lightheaded or the numbness or whatever, you know, whatever that feeling isn't really there, and then sometimes it doesn't kick in until like the second dose, or and it only lasts about an hour ever. But there's a few times, like right now, like I can always tell like my lips and my tongue feel kind of numb or whatever, and I'm like, okay, that's like my marker to tell.
Right.
Like, okay, it's kicking in because it's, you know, and that's why I know that it's not mental, and rather than you know, like physiological versus just like imagining it or whatever. Right. It's like, okay, well, I know because I'm losing these sensations or whatever.
Well, that's useful for some patients too. We have one patient who could probably use this twice a week, but instead once a week they go into the room, put on soft music, and just, you know, meditate or pray or whatever.
Right.
So, and that is part of how the treatment works, just like a break from the normal for your brain. So yeah, it's growing new connections, but sometimes in our life we're like, okay, we have 24/7 news sources. We don't need new connections. I just kind of need my mind to like settle in and rest for a moment.
Right. Yeah, because I even choose different music. I mean, like the music that I listen to, like I've experimented. I've been here enough times. At first I didn't want to experiment too much because I wanted it to work. You know?
Right, yeah.
But now that it's functioning, I'm like working with its efficacy, you know? And I'm like, I listen to different things, and I'm like Inya is my bet. That's the best stuff to listen to on Spravato because it's mellow.
Some
and
stuff,
and it's just really, and she has a lot of stuff, so you can shuffle through all that stuff, and it sounds really good, and it helps your mood. You know, it helps you like, you know, it's like the whole watching Wizard of Oz while stoned or whatever, or, you know, the things where like you can appreciate it better if you do this type of thing. Well, Enya, I think is the drug appropriate music,
right,
compared to like some others, because I've listened to some other stuff that I like, because it was all about making me feel good, right? So it's music that I like, but it's still the beats and the rhythm and everything, and the melodies or whatever, they didn't work with the drug the same way.
Right.
So like Sting, you know, Sting is he's got some pretty mellow stuff too, you know, but it's still the rock in there is just a little bit too hard, and it keeps you from feeling that.
Well, what would you say before your first treatment, like as far as like how much more anxiety or depression it was? And as you said, you know, do that.
Oh, well, I mean, I don't even know. if you can compare them now, because the anxiety was so, like, I can't remember. It's like when you're in one mode or mood, you can't remember the other one.
Right.
Like when you're depressed, you can't remember ever feeling good. So when I'm anxious, I can't remember feeling not anxious. And when I'm not anxious, it's harder to remember how bad it really was. But my anxiety levels were just ridiculous. You know, I mean, like.
Well, there's no backstop for it too. Like sometimes this stuff just works. Like, you know, come back in.
I had a therapist one time. I said I was sitting there watching The Office, and all of a sudden I get like these heart palpitations or whatever, and you know, or like not palpitations, but like chest. You know,
like heart's fluttering.
Like a tension. Well, it's more like it's like when your muscles get tense around your chest, and you feel, you know, that kind of it's the panic. And I said, I don't have panic attacks. And he said, you don't understand. He said, you're always having a panic attack. And I'm like, that makes perfect sense. Because what would happen was I knew all the different types of symptoms from panic attack.
Right.
And I would get them randomly throughout the day. And I'm like, I don't understand. I'm watching Friends right now. What, you know, I'm in a good mood. Why would my chest be acting funny, or my vagus nerve or whatever, vagus nerve be, you know, bothering me or whatever. And it all makes sense now. And my brother and I, we because of Marvel, we, you know the in the Hulk, you know, that's my secret. I'm always angry.
Right.
We started this new thing. Like, that's my secret. I'm always having a panic attack. And that's my secret. I'm always anxious.
Right. That way you don't have to worry about one starting because you're just in it.
Yeah. Right.
So it's almost like a dream state, where like if you're in one, you're like the other one's fading, or any.
Right.
That sense of reality.
So it's kind of a. Yeah. It's such a long-term state of feeling it that it's really hard to differentiate, you know, between them.
Okay.
It's like the IBS, like we were talking about that because IBS pain.
Right.
And like if somebody were to say at any point, you know, does your stomach hurt? And I stop and I'd be like, yeah, it does. Like right now, I could stop and I'm like, yeah, it does a little bit. But I'm always in a state of stomach pain from IBS.
Right.
So to me, it's not the same as it is for you. And you know,
What's a good time to stop anyways if the blood pressure is like, hey, I want to be the center of attention now?